I'm Dr. Rashel Tahzib. I'm a physician here at Advanced Health Integrative Medicine. I practice anti-aging and integrative medicine, which have positively changed my life personally, and my goal has been to bring the same to my patients. Today I want to talk to you about integrative medicine, what it is, why it's important, and how it works and how it's different. Integrative medicine is healing-oriented medicine that takes into account the whole person, body, mind, and spirit, and their environment, and uses all modalities to treat the patient, conventional and complementary, to promote health and healing. I want to bring up three aspects of integrative medicine that I think are very important. The first is that integrative practitioners look at the body as interconnected. Conventionally, physicians are trained to look at the body as isolated systems that manifest symptoms. Integrative practitioners realize that the body is interconnected and attention must be paid to all organ systems at once. To exemplify this, for example, you can have a headache and the symptom will manifest in your head, but the problem can actually originally be in your hormones. You can have hormone imbalance and feel a headache. Or another example is you can have a rash. The problem will manifest in your skin, whereas it can originate as an immune imbalance. It can originate as an infectious problem. It can originate as an allergic problem. And all these systems are interconnected. So integrative physicians, when treating a patient, really always address all organ systems at once. Another aspect of integrative medicine that I think is really important and I want to share with you is the fact that integrative practitioners really focus on the cause of disease. Whereas conventionally, again, in training, physicians have been trained to look at the symptoms a patient manifests with. And, we kind of group the symptoms into groups, and they fall under different diagnoses. And when we have the patient's symptoms and the diagnoses, traditionally, physicians are trained to prescribe the corresponding pharmaceutical medication to help the patient cope with the symptom or the diagnosis. This, I think, is a really important point that I'd like to differentiate, and I think it's really critical to health and disease. And the reason that it's important to look at the cause and not just the symptoms is that if you overlook or fail to really investigate the cause of symptoms, the underlying cause will go unnoticed. It will keep growing and manifest into bigger and bigger problems. And then, you can develop, for example, chronic disease. And, chronic diseases being heart disease, diabetes, cancer, Alzheimer's, Parkinson's. These diseases kind of don't show up overnight. Most of the time, these diseases have been in the making for years and years before, sometimes 10, 20 years before. And the way your body is telling you something is wrong is by signaling to you with your symptoms. So integrative physicians always like to investigate the symptoms, not just with the diagnosis, that means finding the name of the disease, but by looking at the cause. And how we look at the cause is by doing functional testing. And functional testing is different than the general tests that, a general practitioner, the general blood tests that they would run. Functional testing looks at early biochemical markers, cellular biochemical markers of disease, or other early markers of disease that can show up years in advance, before general blood tests would show up as abnormal. A lot of times patients tell me, they come in with fatigue or, different symptoms, and they've had blood tests year in and year out with their doctors, and the blood tests have been normal. And they ask me how this is possible. A main thing here is that the general blood tests, which integrative practitioners do use, but they use additional testing as well. Those general blood tests for example, the CBC and the chemistry that's routinely done, they look at the end organs. They look at the liver, the kidney, the red blood cells. Most of the time when we're seeing abnormalities in your kidney or in your liver, there's already some damage done. Integrative practitioners like to use the functional testing that finds the markers for disease earlier on. So, we like to kind of find the signs of, that the disease is in the making earlier on so we can treat it before the end organ damage is done, before the disease manifests. And the last aspect of integrative medicine that I think is really important is the treatment approach of integrative physicians. In treatment, we do use conventional modalities like pharmaceutical drugs when necessary, but we find that when we address and kind of identify the cause with the functional testing, a lot of times we find, for example, toxicity, heavy metal burden, nutrient deficiencies, different latent food allergies, immune responses, inflammatory conditions. And when we treat these conditions with, bioidentical or natural hormones, infusion therapies, research-based nutraceuticals, targeted amino acid therapy for neurotransmitter imbalance, when we address these things, we find that we don't need as many pharmaceuticals, and we get great results.